for actually taking the time to come. Obviously the purpose of the meeting is very much around the first public viewing of the white paper and the solutions that Gateway for Health have put forward with its partners, as the white paper affects companies and general practice alike. I'm John Seymour and I'm one of the directors of Gateway for Health.
Okay, so N3 is N3 was put in place going back 4 or 5 years now. The primary driver behind N3 was to connect every single NHS establishment in England, regardless of size, from a small GP surgery through to a large acute. The National Programme for IT has probably not, I think it would be fair to say, probably not delivered quite what was envisaged or expected at the outset. However, the N3 data network probably has. N3 Voice has been around now for 2 or 3 years and has been deployed across England and is currently being pushed through in NHS Scotland as well. So there's some of the services around N3 itself. The slide there is really just expanding upon the original intention of N3, and I think by far and away the biggest use of N3 today is internet provision. Other than that, I mean, Choose and Book is obviously on there, which some of you may be familiar with. NHS Mail is an application to which most people are gradually migrating.
My name is Everton Stewart, and from a company called Retail, we manufacture voice recording cards, and we're the only voice recording manufacturer in the UK. So we can record all the voice traffic, and it's recorded in stereo, which means if you're having a conversation with one of your patients, you're on one side on replay, and the patient is on the other side. You can hear clearly who's saying what and when they're saying it. We can also mix that with ISDN traffic, so if you have ISDN lines as well for disaster recovery and for redundancy, we can mix those two things together in one system, in one server as well. We have implemented it on a couple of sites in Birmingham, and we also have it installed at multiple NHS and PCTs up and down the country as well, working on other types of lines rather than just N3 lines as well. Simple screenshot of the software allows you to search for calls by date, time, duration. You can add notes to the call, so if there's a complaint or an issue or a training issue you need to look for, you can tag that with the call, and then you can search for that historically and bring the call up. You can then export that and send it as an email attachment if you need to clients.
I just want to sort of go over really where our experience comes from. As I said, we started about 2.5 years ago doing telecoms and clinical support services for primary care, associated businesses and organisations. On the telecom side, we've done intelligent network numbers, 0845, 0345 numbers, and all of the stuff that goes with that. Much of our time has been spent, concentrated on how to improve the efficiency of practices using the telephone, and how we can improve patient access. Always a big kick on patient access. Patients say it's never good enough, we can't get through, and with call queuing and all the things that intelligent numbers bring, we've helped a lot of practices down that route. On the clinical side, we provide in-house cover, holiday cover, disaster recovery service, provide doctors and nurses to surgeries and conduct clinics. Believe it or not, in just over 2.5 years now, we've got almost 300 surgeries that we deal with, so it's a fair number. We've expanded greatly.
My name is Nigel Mead. I'm actually one of the programme managers for GraphNet Health, responsible for the customer base we've got in the West Midlands and North West. GraphNet have had 16 years experience in providing patient-centric solutions. We have a standard policy in terms of developing real and long-term partnerships along with other customers. We conform to both the EGIF and IG stock standards. We have over 10,000 current care professionals that use our GraphNet system at the moment throughout the country. We've currently got our systems deployed to over 40 trusts, again within the UK. What we specialise in is our birth to death record. So you're born and you die. I think that's pretty much how I can sort of sum it up. Throughout that, you'll get various integrations with the NHS through childhood, growing up, adulthood, and then finally into declining years. And as you start to go through that path, through the various life and styles of your sort of treatment, you will hit various different places, and each time you hit that, you'll get a different piece of information recorded within a different separate record.
My name's Steve Riley, I'm from Enhanced Healthcare Services. Just to give you a very brief background, we were established about 5 years ago, and our main core business at that time was supporting public health. We're part of a group of companies with about 36 million. Our companies are ISO accredited. The group of companies that we're part of work in the healthcare market, social care, buildings and maintenance, admin and clerical, and we've also got an energy company. The challenge is, as I see it, because we're up and down the country all the time, is with the new provider arms and consortias can be made up of GPs from cross boundaries in the areas. Provider arms normally in the PCTs are splintered within that area. There could be a very, very difficult situation for some consortia where they've got GPs from different areas, when the commissioning services that one, the provider arm won't travel there, and also regarding some of the services that the provider arm produces, that it actually may be not suitable in that area anymore for that consortium. So then will this affect cost, price and even the outcome?